Anticholinergic medications, a fun and easy guide to mastering them. Anticholinergic medications, the fun way to remember and master them. Okay, let's talk about anticholinergic meds. If cholinergic meds were the social butterflies that love making connections, then anticholinergics are the strict librarians who say, shh, enough talking. They block acetylcholine, meaning they turn off the rest and digest system. And let me tell you, this leads to some wild side effects that you need to know for your exams and clinicals. Stick around, because I've got a fun memory trick, a life-saving antidote, and some nursing tips you do not want to miss. What do anticholinergics do? Alright, so remember how cholinergic meds make you all wet and messy with that sludge stuff? Well, anticholinergic meds are like a desert. They dry you up. Anticholinergics dry mode on. Let's look at this memory trick, the 4Ds of anticholinergics. Here's how you can never forget what anticholinergics do. Just remember the 4Ds. First D stands for dry mouth, no spit sour, thirsty all the time. Second D stands for dilated pupils, blurry vision, can't see up close. Third D stands for dry skin, no sweating, arse overheating risk. The last D stands for distended bladder, trouble peeing. Basically, your body dries out and slows down. Let's look the prototype drug atropine, the dry master. Now, the OG of anticholinergic meds is atropine, aka the desert drug, because it dries you out fast. It's used for bradycardia, meaning if someone's heart rate is dangerously low, boom, atropine speeds it up. Atropine, which is heart rate too low, let's go. Side effects and adverse effects, what to watch out for. Okay, so what happens when you take an anticholinergic? Now let's look at the common side effects. Dry mouth, they'll be drinking water all day. Blurred vision, pupils too big. Constipation, nothing's moving. Urinary retention, they feel like peeing but can't. But if you see these adverse effects, it's time to call for help. Adverse effects, which is the one we need to call a doctor. Severe tachycardia, heart racing too fast. Extreme confusion, brain is dry too. Hallucinations, seeing things that aren't there. Heat stroke, no sweating or body overheating. Remember, too much dryness, anticholinergic toxicity. Who should avoid these meds? Contraindications. Some people should never take anticholinergics, and here's why. Glaucoma, pupil dilation, does increased eye pressure. BPH, benign prostatic hyperplasia, bladder already struggles to empty, this makes it worse. Tachycardia, fast HR, atropine speeds it up even more. Bad. Foods and herbal interactions, what to avoid. Alright, now, if you're on anticholinergic meds, certain foods and herbs can make things worse. Avoid these while taking anticholinergics. Alcohol adds to the confusion, disaster. St. John's wort messes with absorption. Caffeine dehydrates you even more. Potassium supplements can cause stomach ulcers. Overdose, here's the antidote. If someone gets way too much anticholinergic med and starts acting like a confused, overheated mess, what do we do? Physostigmine, the rehydrator. This is the antidote because it brings acetylcholine back to normal, basically reactivating the nervous system and reversing toxicity. Nursing considerations, what you need to know. As nurses, here's what we're always checking when giving anticholinergic meds. Nursing alerts, monitor heart rate, watch for tachycardia, check urine output, bladder retention risk, encourage fiber and fluids, constipation is real, educate about overheating risks, no long sun exposure. One last tip, educate your patient to get up slowly. These meds can cause dizziness, and nobody wants a "I stood up too fast and blacked out" moment in the hospital. Boom, you just mastered anticholinergic meds in under 10 minutes. Now you know the 4Ds memory trick, what to watch out for, and the antidote.